All right, welcome everybody to this week's episode of Health Bits and Politics. We've got another exciting show here for you today. Before we kind of get rolling, just for those that are a little bit new to the scene, just to give you a quick look at where you find us. Come on over to our site, your-mp.com. You click on the Your Media Hub. This is the little hot area to come to. Give you a little breakdown on the shows for today and on Thursdays. A little further down is the breakout on who's upcoming. And then very importantly, here are all the various links that you can watch the show. My recommendation, if you'll help us, would be to go to each one of them and subscribe to every one of these channels because it helps build our numbers on those various sites. And a couple of them will send you notices when we post videos because we always post them between now and the end of the weekend, both the Wednesday and Thursday shows. So by first of the week, you can catch all the shows. So we're really excited you're here. We really need to keep working on a regular basis on getting back control of healthcare in America, which is exactly what we're up to doing. And on that note, we're going to have a great speaker for today. As I said, we've got Robert here, and Charles is going to do a nice job of introducing him, and then Robert's going to have the floor. So Charles, if you would.
I would, and let me share my screen. And let me just start over here with that same website. So Dr. Koshnick is a retired physician from Detroit. Detroit Lakes physician, retired. And like a lot of presentations over the years here on Freedom Hub, he's a big proponent of primary care. Now, we have sort of a love-hate relationship with primary care on this show, which will be understandable as we get through the Q&A after this show. We definitely like primary care, especially monthly subscription primary care, which is called direct primary care, specifically because it adds time to the doctor-patient relationship, which our many DPC presenters have shown leads to an improvement in the doctors. They become more integrated as they struggle to treat the real epidemic in this country, which is chronic disease, which has exploded since the 80s from less than 10% to over half the country. Let me show another screen here. Here is where I was fooled, Bob. See Detroit? Thought that was Detroit, Michigan. I did not read Lakes. That was my fault. There he is in an article about his book, which he will present today. It's a mouthful, but very interesting. The patient-directed nimble healthcare, reduce health and financial disparities in the U.S. with tax credits for direct primary care and HSAs. Now that's a nice combination. He'll go over the nimble acronym. It's also in this article. Certainly tax credits have been a hot topic ever since I was a Republican congressional staffer in the early 90s, fighting Hillary Care, when the Heritage Foundation was pushing us to push tax credits, whereas on the other side, John Goodman over at now Forbes magazine was pushing us to promote health savings accounts through the group model or the insurance model. And one criticism Bob has with the status quo is fee-for-service medicine, which again is sort of, we can argue about that, but no question he's right that when you don't have the money for fee-for-service, that can delay care. Also, it definitely leads to overutilization as the busy primary care doctors become funnels just for specialist appointments. And specialists always find a problem with you requiring their expertise. He has a new health savings account idea called an Empowering People Option Act, which he'll get into more. That seems to be focused on primary care. Now, friends know that we are known through Forbes magazine, who featured our brokerage for combining health savings accounts with sharing. And we are also promoting HSAs and individual policies through ICRAs, the individual coverage health reimbursement arrangement through bigger and bigger employers with sharing and HSAs. And then we are also promoting this thing that doubles your money over 3 years, the health matching account, which does allow for use of it for DPC monthly subscription payments. And finally, as the lobbyist for the world's oldest health freedom organization, National Health Federation, this is our campaign to expand HSAs, specifically to allow nutritional supplement purchases, but any way you expand HSAs is good, as I'm sure Bob will explain. And finally, I think Pam Nygaard is on here. Freedom Hub is promoting functional assessment, which we hope DPCs will incorporate to improve the quality of the treatments so we can get a good idea of your blood and DNA, and more importantly, your local environmental toxins. That is something that most doctors are clueless about. And then we are promoters of the Cash App from WOW, which will facilitate the cash market, which we believe is critical. And with that, I will stop sharing. And Bob, it is now your turn to tell us about your idea with these new savings accounts to really improve the use of primary care and to get those third parties out of the market.
So Charles, you reference patient-directed nimble care, healthcare. I wrote that in 2020, pretty much on my own, and then the most recent book is Empower Patient Accounts, Empower Patients. If I were to rename it now, I would call it Empowering People Accounts. But anyway, that's the book that Dave Racer and I worked together. So just a brief history. I graduated, and in 72, I was in internal medicine and family practice came in, and I switched over to family medicine. And I helped set up a family medicine residency in Fargo, and then I went out. My dad owned a farm between Frazee and Perham, Minnesota, two small towns of about 2,000 people. And I first got involved in politics because somebody suggested I get up on a health systems agency that was being formed by 1974 legislation. And initially I thought it was a good idea to have some oversight that looks at new construction, but I quickly realized there was a way to maintain monopolies, and it was totally dominated by the big systems, and small clinics like I was involved with did not have an opportunity to go through the process. You'd have stacks of required documents, and it was during the time of high inflation, 15% plus. And by the time you got through the health systems agency, prices had already increased 20%. And I became very disappointed with the entire concept. North Dakota dropped it. Unfortunately, Minnesota put it into the state health department and made it even worse. And the second thing that happened is there's a trivial lawsuit with one of my fellow clinic members, and it really was trivial, but she ended up committing suicide. And I became very disenchanted with malpractice laws, and particularly the fact that St. Paul companies had total control of it, and lawsuits in the 70s were going out of control because physicians had no control over what happened in the lawsuit. St. Paul companies would settle it, and lawyers quickly caught on to the idea that you brought a lawsuit and you could settle it. So I became very active in medical politics, the Minnesota Academy of Family Practice. I was on the board 3 different times for 6-year stints, and also on the Minnesota Medical Association. So when I retired in 2018, I sat down and I wrote 400 pages on healthcare, and I put it together in a book that was 560 pages. And my wife said, nobody will read that, it's too long. And it kind of had a lot of different aspects. So then that's when I condensed it and wrote this book, Patient-Directed Nimble Healthcare. Nimble stands for nourish character, intake wisely, maintain health, be responsible, live intentionally, and get involved in local community. So my wife read that and she said, "You got to rewrite it." So then I got Dave, and we wrote this. Dave and I wrote this book, Empower Patient Accounts, Empower Patients. So anyway, that's how I got involved in basically in healthcare politics, and but maybe I was disgusted with what happened when I went to Perm and set up a clinic within visual sight of my dad's farm. There are two elderly doctors, and they charge $4.50 an office call. So I opened up the clinic and charged $6.50. I mean, nowadays that seems ridiculous, but what it showed me is I watched this whole transition towards corporatization of medicine. And I initially joined a clinic in Detroit Lakes, and when I was on the HSA, it appeared clear to me that bigger was better. And part of the reason was small clinics got screwed with reimbursement. You know, we had no pull as a small clinic of 6 people, but big clinics could negotiate great insurance contracts. So right off the bat, it became clear to me that the system was really rigged. Dave Racer did some good work on that. Bedelia gets 106% of Medicare rates. Mayo Clinic gets 282% Medicare rates on their insurance. I mean, that's shows a spread and how unfair the present system is. So it quickly became clear to me that what needed to be done was you need to get back to what it was when I went into practice, where people paid for office calls and it was affordable. But the way prices have spiraled out of control and corporations have taken over the pretty much 90% of the payment in one way or another, either the government or other forms of third-party payers. So the individual has been taken out of it. And of course, Medicaid and Medicare drove inflation skyrocketing. And then Obamacare really just added enormous amount of regulation that clinics have fought with. I did move to Detroit Lakes, which is 22 miles away. And the clinic there was initially 6 and then 8, and we went up to 16. But with Obamacare, originally we had 1 RN and otherwise just LPNs, very low overhead. When Obamacare came in, we had these massive explosions of teams of RNs and other people doing data. And of course, we had to get on electronic medical records, which was a huge expense. We joined with a clinic in Fargo out of self-preservation. It then became clear when 1998, when provider-based billing gave a huge advantage to corporate medicine. In Minnesota, we do have a corporate practice of medicine doctrine, but it's been watered down by the attorney general said that, well, nonprofit corporations are fine. And then nowadays, private equity is flowing in through management service organizations and the friendly doctor routine where they set up contracts so that basically they control the flow of money. So independent practice has almost disappeared in Minnesota because of the nonprofit corporations that started after the Attorney General ruling that nonprofit corporations don't apply under the corporate practice of medicine. The corporate practice of medicine is that the sole loyalty of the physician should be to the patient, and that you should not have a corporate loyalty to a corporation, because then you introduce the profit motive of the corporation of non-medical people. Now, other fields like lawyers still maintain a corporate practice of the law profession, but we lost it in medicine. basically through the 1973 HMO Act that basically allowed corporations to practice medicine without a license and to be an insurance company without a license. So anyway, in the book, it is oriented towards primary care because that's my background. And I'll point out some things in the book. So I talked about the determinants of health. You really, what makes a big difference, 38% of health outcomes are affected by what people do. Healthcare only changes about 11% of healthcare outcomes. But if you drink and you're obese and you lived risky lives, use drugs, etc., that's what really leads to early deaths. Genetics obviously is part of it. Your environment is part of it, and other things. But you've got to get down to personal responsibility, and if the people are not engaged in their health care, it's taken care of, or it's free, or free through Medicaid, or almost free through Medicare. They put that out of their minds and they don't live healthy lives, which makes the big difference. Like the insurance company only makes a small difference. That's not really healthcare, that's sickness care. So that's a totally different issue. Anyway, I'd like to see our system be primary care centered. It's far from that because we're basically hospital and specialty care center. So the question is how to do that. And the way I would do it is I would make primary care independent. I don't think that they can be under a corporate system and really have the patients. The corporate system expects them to order everything through the system, not necessarily the best providers, not necessarily the cheapest lab or the cheapest radiology, etc. So it basically is a moral injury to physicians, primary care physicians, to be in a corporation, in my opinion. Our sole loyalty is not to the organization or to the patient, because we have a dual loyalty. And the reason that primary care is good is it does what's called incremental care. It takes care of your high blood pressure or your high cholesterol, or there's counseling regarding I see some of these comments that are interesting. Use RICO to break up the AMA. But with incremental care, that's the way to get to help people live healthier lives. So that really makes a difference. It's very clear from numerous studies that primary care makes more difference than specialty care. So the second thing is advance a patient-friendly medical market. We don't have that right now. It's a rigged market. And it started with a lot of laws through Congress that have, through the years, starting with the War Board saying that health insurance was not a wage, was not influenced under the wage control laws. And then in 1954, the Congress made it a permanent deduction. And then, of course, Medicare or Medicaid came in, and then the high-tech law that insisted everybody have electronic medical records that almost anybody can access in one way or another. And then Obamacare that laid layer after layer after layer of additional administrative requirements. So what's happened is administration since 1970, the most recent update was that it's increased 4,000%, whereas physicians, it was about 35%, it might be up to 50% since 1950. So we've had an explosion of administrative costs that just dragged down the entire system at enormous costs. So what to do about it. They're certainly empowering patients. Telehealth is good. Direct primary care you mentioned is good. I think direct primary care is the future of family practice if it's going to survive, because otherwise they're just going to be replaced by PAs and nurse practitioners, which they have their place, but they work much better. In fact, I had a nurse practitioner, a nurse midwife, and a physician assistant working under me. I know one day we saw 62 patients. It certainly expands the reach, but it provides coordinated care. And it's been shown through the Louisiana studies and other studies that if you have nurse practitioners and physician assistants, working under a primary care physician, that's much more cost effective, saves millions of dollars in their study down there. So I see Jeff has put up my Empowering People Option Act. So this is an act that I put together partly from Sessions' bill, but a lot of my own ideas. And basically, this is what I would pass on a national basis if it was up to me. Basically, it sets up the EPA accounts. It sets up, does the two things that needs to be done with primary care arrangements, which is one, it's not insurance and it shouldn't be under state insurance laws. And two, it should be a qualified medical expense, so HSAs and health reimbursement accounts, individual coverage health reimbursement accounts, flexible savings accounts, et cetera, could cover them. And then maintain state flexibility and regulation of health insurance. We shouldn't federalize it. And then promoting price transparency is important, but it's not important until patients are paying the bill, because if somebody else pays the bill, who cares how much it costs? And that's where we are right now. So I could go on, but that's basically my story. Yeah, so here's the book, Empower Patient Accounts and Empower Patients. I would put that Empowering People Accounts now. If I were to rename the book, that's what I would rename it now.
Very good, Bob. I just wanted to let everyone know that I also sent this link in the chat. So if you want to grab it that way, go right ahead. That was really good. Like you said, there's been a lot of people on this show, some great ideas. The challenge always is to get the stuff implemented.
Right.
So that's why it's nice to see you're kind of trying to work on that side of the equation. What are anything that any of us could do as viewers today and people that watch this when we post this? What else can we do?
Well, I'd like to find a congressman that would support the bill, Empowering Patient Accounts. That's the first step.
Have you made any overtures to do that? I mean, have you had any bites?
I have not gotten that far yet. I'm trying to work through. I'm the chair of the Republican
thinking like a Rand Paul.
Yeah, Rand Paul would be good. I'm kind of I'm trying to work with Sessions group, and actually we have there's a chart. We're going to be talking with somebody from his group to see if they're interested in, because I've taken quite a bit of this from that Sessions bill. The problem with the Sessions bill is that it tries to reform the ACA, it tries to reform Medicaid, it tries to set limits with abortion. I mean, it tries to do too much, and it's not that I disagree with the ideas, it's just that you got to elect Republicans first to do any of this stuff other than having the government run healthcare. And so the initial thing that Republicans have to do is get people to trust Republicans on healthcare, which they don't right now. And in fact, Republicans often just ignore healthcare,
Right,
and that's disastrous.
at their peril. Charles, anybody else too, if you have a question, please raise your hand. And Charles, I see you've got yours up.
Yes, folks, you'll find the raise hand icon around the reactions tab on your Zoom controls. I have a number of questions. I'll just start with one here, Jeff, and you can come back to me.
Okay.
So the Empowering People option at these new accounts, I'm sure you get questioned by Republican staffers that you talk to. And by the way, for something this new, if I were you, I would start with Dave Racer and some of your local Republican politicians in Minnesota, because sometimes I found lobbying healthcare since 1990 that you got to start with some of the Freedom Caucus people just to get the thing introduced and then get co-sponsored and build slowly. But you might get pushback from staffers on whether your plan duplicates what they're already trying to do. And I'll share my screen real quick here to show what I mean here. Let me just share here and hide these floating controls that blocks your ability to see anything. So we combine health savings accounts with sharing, and we, like a lot of groups, are pushing to expand HSAs to allow for eligibility for whatever you pay monthly to a DBC arrangement, or medical cost sharing, or supplements, or a whole variety of other treatments. And then the new account that we licensed health insurance agents are selling nationwide is the health matching account, which doubles your money over 3 years and already allows for use to pay these monthly DBC arrangements. And this account is the best one for people who actually are utilizers of healthcare, whether they're paying a DBC arrangement, or they're expecting a baby, or braces, or have chronic diseases that require a lot of visits to specialists, or you want electives. So this is a market fix, bypassing government. And of course, through the ICRA, that's going to bring HSAs into larger and larger companies, as Joe Markland presented 2 weeks ago on this show. And
Can you explain the health matching accounts?
Sure. Let me go back here and go to the explanation option here. And if everyone sees the ladder here, let's say you need 10 grand. Kid might have braces. Maybe you're old. This is John Goodman at Forbes characterizes the HMA as the best supplement for Medicare, because unlike a real supplement insurance policy, it's not limited. This is a cash account, so it's it really empowers you, whatever your out-of-pocket expenses are. And particularly if you're old, you're going to face dental expenses and a lot of gaps with Medicare. So let's say you want to build 10 grand. It takes 3 years. You got to have patience. That's the only catch with this thing. It's a Milliman actuary firm math formula. So they have 11 different levels. Let's say you want 10 grand. That costs $140 a month. See the lower left-hand number, 140. Look at the right-hand green number, 110. You're subsidizing the pool over the first half year. You can use it immediately, but it's going to have less money than what you put in it. So don't use it until a year has passed. You have to give it time to appreciate. By the first year, month 12, you have $1,680 that you've put in, 140 a month times 12 months. The value of it is about 12% more than what you put in it, 1980. So now you can start using it if you have to, but we'd prefer you just use your credit card to allow this thing to build. Much like I'll sell an HSA as well as this to the same customer because the HSA is a tax shelter for retirement when you need the 100 grand for long-term care and out-of-pocket expenses. Now
So
look at this. Go ahead.
where does the increase come from?
It's a system of increasing benefits, just from the math formula of the system itself. It's not an investment, it's not insurance, as the insurance commissioners have ruled. So the actuary firm Milliman came up with 11 different levels of monthly payments, from 40 bucks a month up to $600 a month, to double over 3 years from 2,500 up to 60,000.
Okay,
So by the end of the third year, you've paid 5 grand, which is $140 a month over 3 years, but its value is 10 grand. So if you break your leg and have out of pocket expense of $4,600, that red number.
okay, I'll look into that.
Okay, that's the explanation. But my point is, there are works afoot to make the HSA more useful for primary care and every other out of pocket expense. So why create the additional empowering accounts?
Well, the problem with HSAs is that there's a great idea originally, and it's still a great idea, but it's been what's happened is that it's basically become an insurance plan. It has to cover all primary care. It has to meet all these ACA mandates, and it's been so that the value of it, the relative to other plans, HSAs have become much more expensive because they've been mandated to cover so many different things. Only 10% of people have HSAs. I don't disagree with the entire concept of HSAs, but it doesn't cover if 63% of people in December said that they were going paycheck to paycheck, that doesn't change the model. What needs to happen is we need to change the mindset. We've gotten this idea that healthcare should be, quote, free and somebody else should pay for it. And that mindset's disastrous. But the problem is people don't have the cash available. So what you need is basically, my EPAs are basically another form of HSAs that isn't laden with all these requirements that all people, 90% of people that don't have them, do have them, can have them as an option. I mean, to me, if 90% of people aren't paying for the healthcare, you need to give people something that'll give them an incentive to change. And the way to do that is to give them something that they own, like an HSA, but it has to be first dollar coverage. I just knocked you off the street here. So I might have to go in because I've lost.
No, you're good.
Here you are. Okay.
We see you there.
So
I was gonna say one real quick, one thing about that, what you're saying is the key about the problem with the HSA is you have to have a special insurance to even get permission to get one.
right.
So that's its enormous drawback, why it is such a low uptake of people having it, whereas what you're talking about allows everyone to participate.
Exactly. So everybody would have this option. That's why I call it the Empowering People Option Plan or Act. You give everybody the option that they could have an HSA-like account that isn't laden with all these other things. You're basically moving the buying power from the third parties to the individuals. And then if they have a major medical expense, they could have a high deductible health plan, or they could have some of these other things. They could still have maybe some of these other programs because it could be integrated with Medicare and Medicaid and state health plans like we have MinCare, Minnesota Care. Indiana has done something like this with their power accounts. The problem is they made it so difficult that basically it doesn't function. It doesn't function very well. It would require a federal waiver, like to implement it in Medicaid, for example. It can be done. It has been done, but the Indiana plan is way too complex. And it doesn't really put money in people's pockets.
Just to push back a little more, so the bills around HSAs would decouple HSAs from the requirement to have a policy structured appropriately to allow for the HSA, which is the high deductible requirement. So that would make HSA stand alone as HMAs are, number one. And number two, you mentioned the Indiana Medicaid waiver, which is great. And yeah, of course, it's government, so it's going to be overly complex and needlessly so. A link that Charles Ford just put in chat also is useful for this conversation. About a month ago, Rob Greiner presented Trump's attempted expansion of Medicare combined with MSAs, the original name for HSAs, medical savings accounts, which are funded by the government. And I believe your empowering accounts are funded in part by the government, correct?
It is.
Okay, so that's happening now with MSAs with Medicare, and it was not followed through with, but a lot of folks want to see more government funding of the health accounts for retirees.
Yeah, the medical savings account problem with that was there was a limited number of them. Insurance companies weren't going to, spend a lot of money to promote something that there's a limited number of. You're talking about the ones in the early 2000s?
Yeah, it's not promoted very well. And another problem that you mentioned with HSAs, there isn't real buy-in out in the market. You got to change culture sometimes before you change the law. Employers aren't sufficiently funding them. So that's exposing all these blue collar workers to insufficiently funded HSAs so that they do get in trouble when they have a health issue because HSA only has $500 in it. So yeah, in those cases, the HSA is useless. So you're saying that a government funded employer account is empowerment account is the fix for the deficiencies of the HSA?
Yes, basically. I mean, it would follow under the same rules as the HSA. It just wouldn't have all the overhead. But the other thing, it would be available to anybody who wants it. And I think employers would look very favorably and would encourage people to do that because they're footing the healthcare bill right now. And what I think Dave Racer said the most recent was $31,000 for a family from an employer. I mean, something ridiculous. So the problem is going to be for people that don't think government should run everything is that in our state, they're looking at free primary care, mandating free primary care. If the Democrats come up with government provided health care, people are going to jump at that. The question I have is what kind of hook can you bring people back to being personally responsible for their health care, which is what makes the big difference in health outcomes. And to me, if people could have a financial asset, it would improve health and financial inequities because it would give them an asset to be more responsible with their living, which again is the thing that really makes a difference in their health outcomes. So you've got to transfer the buying power to the individual. And this is the way that I could see do it on a competitive basis. You can get Medicaid and you have nothing when you die, or you could have Empower patient accounts where you could accumulate $3,000 or $4,000. I've been wavering between the two. I started with 1,000, and I talked to a friend from LA, and he said 1,000 won't go anywhere. So all of a sudden, I thought, well, maybe it should be 3,000 or 4,000. Then I went to 3,000. The Sessions bill is 4,000, so now I'm leaning towards 4,000. But that would be significant money that people could accumulate and pass on to heirs or use in retirement.
Yeah, no question, boosting savings, whether funded by the individual, corporation, or government, would be empowering. And our savings rate is so horrible, and people are scared of going to the doctor and going bankrupt. So yeah, that's all good. One last question before, Jeff, you want to turn it over to Charles Ford. So one thing we haven't discussed, something I tried to put in the promo, but you pushed back a little bit on. One good we're in the natural care here. Okay, we're big critics of allopathy because of their failure to stop the real epidemic, which is chronic disease. Half the country has it. Pharma's pills do nothing for it. People get chronic diseases, they leave their allopath, if they're younger especially, and they start their journey going to chiropractors, naturopaths, innovative care, yoga, etc., to fix themselves. And you mentioned healthcare affects only 10% of outcomes. That makes sense. John Ioannidis at Stanford had that infamous study that only a third of pharma, these studies actually are true. We know the journal editors discount the value of any of their studies.
You're talking about the Oregon study?
There's so many studies.
Yeah, okay.
And so one thing that we've given the benefit of the doubt to with DPC is that, what I mentioned earlier, because you're no longer rushed, you're no longer on the hamster wheel for fee-for-service reimbursement, checking your EMR record. This time you're given with a patient allows the patient, time to talk about their chronic issue. It allows the doctor time to rediscover the art of medicine. And through becoming a real doctor, not just a pharma pill pusher, they're becoming more integrated without intending to, even allopaths. And that's a wonderful dynamic. We want to see the integrated market explode because we care about, efficacy and things that work. What are your feelings on that? The upgrading of doctors to becoming, you mentioned the incremental care of primary care doctors. Do you see primary care doctors becoming more open-minded on treating these hard to deal with chronic issues? Becoming more integrated, open to more natural care?
I bought some books on that, and I just for whatever reason I found it difficult to integrate that. Maybe it's you just get so bound up, as you say, under the present circumstances. We fired people once we became a corporation. We fired people if they didn't reach the 30 percentile, and of similar practitioners in similar markets. That's when we, in 2008, we merged with a big corporation, and everything changed. The doctors became totally disenfranchised. That's when, in our clinic, which is one of the reasons I'm writing these books, is that I saw the effects of the corporate practice of medicine. So the corporate practice, you've got to break the corporate practice of medicine before you can go into having enough time, with a direct primary care. So I'm a huge advocate of direct primary care, and I want primary care to be independent, and then you could do those sort of things. But when you're supposed to see patients and your numbers are on your electronic medical record of what your expectations for the year are and where you are, and if you don't reach that, you get fired. You don't have time to do that. And electronic medical records sucks up so much of your time that, we did a time study and we found 42% of our time was spent with patients, 58% of our time was doing junk. And when you've got that world that requires you to do all the billing, all the coding for the billing, because if somebody else does it and gets it wrong, it's fraud. It just doesn't work. So you've got to get people paying for their own health care, before you can incorporate that stuff. There's just not enough time without doing that. And in Minnesota, virtually everybody is almost an employed physician of a corporation. So it's a great idea. And I certainly see the value in it, but from a practitioner's point of view, there just isn't enough time. the way that medical care is structured right now.
The sad reality of that is the fact that, like, who's the audience, the patient or that software you're a slave to?
Yeah.
That becomes the problem
It's-
of what you're describing.
Yeah. And the corporation, yeah.
Yeah. Real quick, we're gonna run out of time here before we get too far along, and we want to make sure Charles gets a chance. He's been burning up the chat box, so let's get him on the floor.
Robert, thank you for your contributions today. Frankly, your analysis is beyond what my simple brain can absorb, but I certainly agree with almost all of your conclusions. Couple of points to the things that you've raised is that, was America greater when we had individually owned hardware stores, or is it greater now that we have Home Depot and Lowe's? And I think that's exactly what you're talking about when you talk about direct primary care. Are we better with Lowe's and Home Depots masquerading as the first line of doctor? Or are we better off with an individual who is independent and runs his business accordingly? And I think you pointed that out very well.
Yeah, what happens is, there are some corporations that certainly do things in communities, but the employees of huge corporations don't get involved in the community. I've been a long time founding member of a Breakfast Rotary Club, and it's small business people that are members, or people that are have some control of their lives. It's not big corporations that are represented. You just don't see those people involved in service organizations very much. I'm trying to think. I can hardly think of any in our own club of 75 members. So absolutely, if it were up to me, I would force everybody to be like Subway, where you have local individual ownerships. You couldn't have, you'd require businesses to have local ownerships. I know that's a radical idea that probably wouldn't get anywhere, but it would make communities much healthier.
Well, to your point, there is independent donut shops that have sprung up around the nation, and they band together to they pay a franchise fee for the supplies and so forth, but they operate as a family-owned business. Well, they regularly put Dunkin' Donut out of business, what's right next door. I've seen that happen in 3 different cities. In fact, Dunkin' doesn't even do donuts anymore, partially because of that. So I think to your point, you're exactly right. The other problem with corporate-based medicine, and that's what we're talking about, is that what do corporations do? They look at a spreadsheet. Everything's a spreadsheet. There is no such thing as the practice of medicine. It's a spreadsheet. And the problem with that is you come up with these standards, what they now call wellness, a euphemism, where, okay, you have these numbers, you're normal. If you don't, you're unhealthy. Well, that's nonsense. What is healthy for you, Robert, would probably put me in intensive care. And what's healthy for me might just adversely impact your health. We may all be snowflakes, but we are not, any two of us, the same. And that is the fundamental fallacy of the way corporations run their business. And it's also the fundamental fallacy of how government-controlled medical is being run.
Yeah, it's even worse than that. These electronic medical records allow these pop-ups, and they have no history of the patient. They have no history of the physical exam. So these pop-ups suggest batteries of tests that might possibly be related to a given symptom. So we're chasing all these lab tests that don't make any difference. But that's how your quality of medicine is now measured, is if you're ordering all these tests, and it's so unrelated to actual health outcomes. But the electronic medical records did that, which is all these pop-ups based on expert opinion, not on the patient, not on who you're dealing with, but an abstract symptom. And the second thing they did is you can upcode, because you can, with a dot phrase, you can bring in all kinds of stuff in, and it looks like you spent 2 hours with the patient, even though you didn't ask them a single question, but you could bring in all that information that has been accumulated over time. So it's led to massive upcoding. I would get every 3 months, our system, looks at right coding. Right coding is maximizing your dollar pay for a given documentation. And I just told them this, I'm documenting what I gave them, what I did and the value I did, not what I can code based on what I dragged into the system. So yeah, electronic records have incrementally have led to massive expansion of charges, both tests and just upcoding diagnosis or visits.
Well, as
Sorry.
we close here, Bob, I think you're right that Republicans' reluctance or ignorance about real health reform is going to allow the RFKs that a lot of us here on this channel like for president to inadvertently let the government take over because no one knows any better. And that's despite the commercial work that Jeff and I do as co-host here, upgrading folks out of insurance into medical cost sharing, which is so much better than insurance or government healthcare.
Yeah. We have a lot of patients. I had a lot of patients on health sharing up here, and they were the patients that were really concerned about costs because they shared it with everybody.
Right. And that's all going to go away if, out of frustration with the system you're describing, the status quo, people just say, to heck with it. I'll let Trump or RFK just let the government take over more healthcare.
Well, Saul Alinsky had it right in his 1971 book, Rules for Radicals. He said, number one, control healthcare. And the reason is, I thought about that a lot, and I wonder why controlling healthcare allowed you to take over government, the rules for radicals. It's that healthcare is that important to people. I mean, what's more important than their health? And if the government can take it over, and one party supports the government taking over, and the other party says, we're not interested in it, that's what will happen. The government will take it over. And that party that promotes that will be in political power to do whatever they want. And so in Minnesota, we switched one vote. So one senator lost by 371 votes and two others lost by 100,000 votes. And they just passed everything California has, Minnesota now has. And it's because we totally ignored healthcare. We had a physician running, and I have great admiration for Scott Jensen, and he's been persecuted, and the attorney general has gone after him and everything else on freedom of speech issues. Medical board has 6 times, by the way, nothing to do with medicine, just that he didn't follow the prescribed government approach to COVID. So he got dragged before the board 6 times, and the attorney general came after him. So he's suing them, and I hope he does well. But I went to several of his talks, and he never talked about healthcare. He's a physician, and it's a mistake for Republicans not to have something to offer the young people. I can tell you this, being involved in medical politics, the young physicians and the young people expect universal coverage. I mean, that's just it. It's just ingrained. If Republicans don't come up with a system, a free market system, we will have totally government-run healthcare. There's no doubt about that. I mean, that is obvious to anybody that has any knowledge of what's going on in society. And if Republicans don't have any offer, you might as well close up shop. I mean, that's why Saul Alinsky was right in 1971. Control healthcare, number one. And
Another problem is, Trump had good policies, but he didn't communicate them. He didn't understand them. So the ICRA, is a substantial change, because right now the agents are monopolizing reform of big companies with what's called self-funding and direct contracting, often using DPC on the front end. Jeff and I and others are actually using ICRA to upgrade people from insurance to sharing, relying on Obamacare as the new safety net for sick people, whose pre-existing conditions make them ineligible really for sharing, at least in the short run, and combining that with HSAs or your accounts. But that's going to really please employees, because they'll get savings, they'll get choice, and they'll get a bigger paycheck. Because as the Cato Institute found, the exclusion for employer-provided benefits values $1 trillion nationwide. So that's an opportunity cost. It's lost income, it's loss of control of your benefits for your family. And then, independent medicine through HSAs and the Medicare funding for MSAs, I think, is going to give Republicans a good platform if they learn about it, or if they want to.
Yeah, that's the problem. What I've been pushing is the analogy with school choice. School choice is sweeping across this country. I think 25 states have school choice now. It's a very popular item. People like it. And to me, it's the same model. Have the money follow the student, have the money follow the patient. I mean, it's the same idea, but for some reason, there are a lot of people that anything involving the government, they don't trust the government, and therefore they don't use the government. I mean, conservative Republicans are in that boat, and it's disastrous. It's a disastrous. It's a head in the sand. If it goes away, if we don't think about it, if we don't talk about it, if we don't offer anything, that's how we want it. And that is not going to work with healthcare. You've got to have some alternative of something that'll actually move the needle. And Republicans have not been able to do that. And I have some conservative friends that I understand why they don't trust the government. But they do not see any difference between government-run Medicare, Medicaid, and everything else that, like in Minnesota Care, that's going to cover everybody and giving money to patients or to people in accounts. I call me empowering people accounts, but HSA, which is basically an HSA without all the garbage. I mean, all the required add-ons. And I don't know how to get that message across. I mean, it's like banging your head on the wall that anything involving government is bad, so they won't think about it.
Robert, I'm going to cut in here a little bit because we're running out of time here rapidly. Part of what you're describing at the back end here is exactly what we're all working on. So this is what it's going to really take. It's like we said in the show before, it's kind of death of 1,000 paper cuts. There's a new program Charles isn't even privy to yet that I heard about this week, which is ICRA oriented, but it's got pricing that's conventional insurance oriented, but priced like medical cost sharing. So there's a lot of fixes going on. And it really kind of comes down to just the way people are taking back all these other services on their own, not trying to look for a government solution. And luckily the COVID thing exposed the fallacy of a lot of that. So we're great that you're here today. Do you have a kind of a last 60-second summation here off of today?
Well, we need to change our system to primary care-based system. I don't know. I'm now pushing. I just wrote an article and sent it into Healthcare News, pushing corporate practice of medicine. The idea of the corporate practice of medicine is that you can't be employed, have two bosses. Your corporation and the patient. You need one boss, and that's the patient. That's where our loyalty should be. So I see direct primary care and the corporate practice of medicine, and those things can push towards independent primary care as a way to move us towards a primary care based system, which we know works better and produces better outcomes. But we also need to change the financing system. We can't continue the financing system we have that pours all the money into corporate practice of medicine, or corporations that practice medicine without a license and act as insurance companies without a license, which is what we're doing now.
A good way to
Fun,
kind of put it.
empowering
How
patient.
would we? Yep. How would we get in touch with you, or how anyone follows up or keeps an eye on what you're doing?
If you want to email me, it's bob.koshnick@gmail.com. I appreciate any comments or support.